the first thing that we do differently in functional medicine, anybody that's watching this or listening to this will know, hey, when I get my labs done, there's my number, and then there's this reference range that I'm being compared to, this X to Y interval. We get that reference range largely from a statistical bell curve average of people who go to labs. If you go to another lab, you may see that reference range will vary slightly from lab to lab. It's largely non-standardized. There's some exceptions to that, but most of the biomarkers are not standardized. We have to ask the question, who are the people that are typically going to labs? There are people that are sadly people with health problems. So there's a lot of people that know their body. They intuitively know something's not right. So think like people with fatigue or hormonal problems or digestive problems or different brain health issues like anxiety, depression, brain fog, these type of people, many people within the autoimmune space too, or people have trouble losing weight or hair loss. I could go on and on. They go that impetus is like, okay, something's not right here. And they go to their doctor and the doctor runs the basic labs, and the labs for many people come back quote unquote normal or pretty unremarkable. And the doctor says, hey, like there's nothing wrong here. Maybe you're just getting older. Maybe you're just depressed. Take this antidepressant. Maybe you're just stressed out. Maybe you're just a new mom. Many new moms are told that. I mean, what they're unintentionally telling their patient is you're a lot like the other people with health problems that we're comparing you to. And just because something's common doesn't necessarily mean it's normal. And ubiquity doesn't equate with normalcy. And we need to stop comparing. And I should say this, that comparing yourself to people with health problems is no way for you to find out why the heck you feel the way that you do. So in functional medicine, we're looking at optimal, not average. And so that's a thinner range, a tighter interval of numbers within that larger reference range. That's the functional range. That's where we get our name in functional medicine. Where is your body functioning the best? Where does optimal wellness reside? And let's get you there if you aren't. So we're looking at the spectrum between health and health problems. That's why my second book is called The Inflammation Spectrum. Because by the time somebody's diagnosed with a health problem, researchers estimate that it's about 4 to 10 years prior to that health problem. And you're talking about chronic health problems like metabolic issues, diabetes, and people that are struggling with autoimmune problems and other chronic problems. It's about 4 to 10 years prior to that diagnosis when things were brewing on this inflammation spectrum. So we're looking at the gradient, the continuum between health and health problems, so we can catch the gray areas and get answers for people. And we realize that we want to look at the root reasons of why people are sick. So we're running more comprehensive labs to be thorough, because ultimately nobody is sick from a medication deficiency. Medications are needed sometimes. You're not going to like Lipitor yourself into health one day or like antidepressant yourself into health one day. They are needed. No, I'm not anti-medication. Nobody in functional medicine is anti-medication. We just ask the question, let's be judicious. Let's be nonpartisan, and let's ask the question, what is your most effective option that causes you the least amount of side effects? And for some people, it's the medication and they need to be on it. And many people are alive because of medications. But medications oftentimes for many people, especially people with chronic health problems, medications don't fit that criteria. So we want to find out why you have the problem in the first place. And maybe the medications are needed for a season, but let's figure out why you have the problem in the first place. So looking at underlying gut health problems and chronic infections and hormonal imbalances or nutrient deficiencies or different metabolic issues or trauma from our past that need to be dealt with, that's keeping the body in this inflamed, sympathetic, fight or flight, stressed state. So we're using data, but we're looking at the root reasons. And then we realize we're all created differently, and there's not going to be a cookie cutter approach to getting healthy. And that's bio-individuality. And that's really the heart of functional medicine.